Hello students, welcome to Life Sciences with Jyotishri. In this module, we will be discussing about several bacterial diseases, its pathophysiology and the causative agent, and as well as the mode of infection and vaccines and medications that are used to cure those bacterial diseases. So, in this module, we will be discussing about tuberculosis. This is the most prevalent communicable infectious disease on earth and remains out of control in many developing countries. Tuberculosis is potentially a fatal contagious disease that can affect almost all part of the body and mainly affects lungs. And tuberosity means a round nodule swelling, and osis is the condition. Now, the causative organisms are Mycobacterium tuberculosis, which causes human beings, which infects human beings, and Mycobacterium bovis infects animals. And the other causative organisms like Mycobacterium africanum and Mycobacterium mycoti. And coming to non-Mycobacterium genus, they are Mycobacterium leprae, Mycobacterium avium, and Aciveticum. And coming to the characteristics of Mycobacterium tuberculosis, they are gram-positive, obligate aerobe, and non-spore forming, and as well as they are rod-shaped mesophils, and they are having a waxy capsule which allows bacilli to survive prolonged drying and resist digestion by phagocytosis. And moreover, they are stained under acid-fast staining because of the presence of mycolic acids in their cell wall. And coming to the classification of Mycobacterium tuberculosis, they generally infects lungs and as well as other than lungs and different parts of the body. So under that, they are classified under pulmonary TB and as well as extrapulmonary TB. Under pulmonary TB, primary disease and secondary disease is present, classified, and under extrapulmonary TB, other than your lungs, that is lymph nodes, TB and pleural TB and TB of upper airways, skeletal TB, genitourinary TB, miliary TB, pericardial TB, gastrointestinal TB, and many more. Now, this is the main symptoms that are observed under pulmonary tuberculosis. That is, it affects the appetite loss and mainly in lungs, chest pain and productive prolonged cough and blood sputum is observed, and with the skin, night sweats is observed with pulmonary tuberculosis. Now coming to the main sites of extrapulmonary tuberculosis, it includes central nervous system with meningitis and lymphatics with the neck and pleura, that is tuberculosis pleurosi, and miliary tuberculosis, and as well as the skeletal tuberculosis includes bones and joints of the spine and genitourinary tuberculosis. So coming to the types of pulmonary tuberculosis, the infection of an individual who has not been previously infected or immunized is called primary tuberculosis and is also known as Gons complex or childhood tuberculosis. And coming to the secondary tuberculosis, the infection that individual who has been previously infected is secondary tuberculosis or chronic tuberculosis. And coming to the extrapulmonary TB, which includes, we have already seen in the previous slide, that is the lymph node TB. And coming to the symptoms that are painless swelling of lymph nodes, and coming to pleural TB, which involves the pleura in common in primary TB and results from the penetration of tuberous bacilli into pleural space. And next, genitourinary TB with 15% of the all extrapulmonary cases, and any part of the genitourinary tract can get infected, where frequent urination and dysuria and red color urination and cloudy urination is observed. And with the skeletal TB, Uh, there is an pain in the hip joints and in the knees and the swelling of the knees and as well as in the elbow. Coming to the gastrointestinal TB, we can see frequent dehydration, diarrhea, weight loss, and as well as abdominal pain. And meningitis TB results in hematogenous spread of primary and secondary TB. And TB with pericarditis spreads mainly in mediastinal or hilar nodes or from the lungs. And miliary TB results from hematogenous spread of tuberous bacilli, and spread is due to entry of infection into pulmonary vein producing lesions in different extrapulmonary sites. And the less common extrapulmonary TB includes hypersensitivity, painful hypersensitivity, immediate reaction that is observed on the skin, a rash or whatever, and related conjunctivitis. Coming to the spread of tuberculosis, this can be easily spread through coughing without covering the mouth from the infected patient and in the crowded places with poor ventilation and poor hygiene conditions and spitting everywhere. Now coming to the symptoms included involved with the TBE, which has a persistent cough, continuous cough with chest pain with a bloody sputum during coughing and shortness of breath, color, urine discoloration and frequent urination, fever with chills. Next, coming to the diagnosis part, Ziehl-Neelsen stain with auramine stain is the biological test performed for diagnosis of TB, and sputum culture test, which includes liquid media for 8 to 14 days and agar media for 7 to 14 days, and Levenstein-Jensen solid media test for 4 to 18 weeks. Next, radio filmography is also performed for chest, yeah, and you can see the difference between the healthy report and to the patient with tuberculosis, where the right top corner you can see a clog is present in the X-ray, that is the affected area, and the nucleic acid amplification test. Next, tuber skin test, that is the PPD. PPD is a purified protein derivative skin test that determines if you have TB. If a bump about the size of a pencil eraser or bigger appears, then you are positive with TB. So this is performed 48 to 72 hours later after checked with the reaction and diagnosis based on the size what I have said earlier. Next, and other biological examinations includes cell count, that are the lymphocytes, which means the amount of immunological activity that is raised whenever the infection has entered into the host organism, and as well as the protein content, that is the Pandian revolta test, ascites, pleural effusion, and meningitis. Coming to the prevention measures, mask, BCG vaccine, regular medical flow checkup, and isolation of the patient, and ventilation with the natural sunlight, and UV germicidal irradiation. And these are the preventive measures, that is the personal hygiene and immunization with BCG vaccine, and a healthy lifestyle and the environment. And coming to the BCG vaccination, BCG means bacillus calmette urine, and it is first used in 1921 and is the only vaccine available for the protection against TB. It is the most effective vaccine protecting children from this disease, and 0.1 ml is given intradermally. The duration of the protection is for 15 to 20 years, and it should be given to all the healthy infant as soon as possible after birth, unless the child presents with a symptomatic HIV infection. Co-infection with HIV is accelerated, which progresses both the disease and requires a repeat diagnosis step for both the this disease. DOTS. DOTS is a short treatment, short covering treatment recommended by WHO. According to WHO, it is the most cost effective way to stop the spread of TB in common with the high incidence by causing TB. So DOTS are directly observed treatment. It's a short course of treatment, which means that a trained health worker or other designed individual provides a prescribed TB drugs and watches the patient very nearly. So this is about TB. Thank you.